It's January 2017 as I look out of our backyard and get ready to feed the animals before I complete the video on the recipe to make agar in surgical pathology for Agar Pre-embedding of surgical path specimens. I hope that you all enjoy careers as much as I've enjoyed mine, and enjoy this series of Agar pre-embedding techniques. First, I would like to thank Dr. Isaac Diamondstein of Michigan for contacting me by email in 2016 and ultimately stimulating me to the desire to produce videos of how to use Agar pre-embedding in a surgical pathology practice, a series of techniques that we have used since 1977 and have added to accuracy and efficiency for the slide diagnosing pathologists. As you can see here, on our website, we have the recipe for making agar. And then here we have on the website information about the history of our use in a practice that probably was doing 5,000 specimens a year in 1977 when we started, and currently is in the low 30,000s of specimens, and we are still very certain that this is a highly effective, cost-effective, and accuracy-effective technique in our lab. We hope to share it with you. Thank you. Okay, Brenda Spear is measuring out the agar, 42 grams. And this plastic specimen container is going to be what it ultimately gets poured into, and we'll let it solidify.
We'll put the water to it, distilled water. Put distilled water to it.
Okay, there's the 42 grams. Now we are getting the distilled water, 1400 cc's, measured out. We're going to add it to the container with the dry agar.
And the last time it was PR, and then I don't even know if I ran ER in a PR. I know the ER took a few.
Put some more.
Yepers.
And we've come back into another little area of surgical pathology to mix. Now we're stirring it up with the wooden stick.
It's actually a tongue depressor.
Tongue depressor, here's some of them right there. Is that cold water or warm water?
Cold. Now we're going to put
So
it in
it's
the
with
microwave
cold water and now into the microwave.
for 15 minutes. Do not let it boil.
So you will do it for 15 minutes, and you have to have practice to see what setting you put it on so that it will not boil. Now here's an example of the old solid block where Brenda's cut up a piece,
I cut up one piece right there.
put it into a little plastic container like that.
There. And then what we do is heat this up. And I
Puts
use
into there.
it's according how much you're going to be using, how much you're going to put in here. But you got to let it melt down, get hot, but not boil.
So you got to get it hot. Don't let it boil. This is when you do your daily filling of the tubes for the heat blocks. So the microwave and the agar are simply kept in their containers over in this corner at room temperature. Again, the tubes for the heat block are filled daily, replenished daily, and then a batch of new agar is made up every Tuesday for our busy surgical path lab.
I smell it.
Okay, the melted agar is taken out, and we're going to add thymol to it. And Brenda says that the thymol throws off a pretty intense smell, so stay away from it.
Yeah, don't breathe it in. Just kind of back
So
away from
you
it.
stir it in a little bit. And then after you've got that in, you let it solidify.
Yep. I just put the lid
Now,
on it and stick it back in.
Once
the
Brenda put it in and started the microwave oven, she set her cell phone timer, and in our lab with this particular oven, it takes 15 minutes to cook the fresh agar batch.